An infectious disease that broke out in 2020 put the Chinese city of 11 million people on the headlines all over the world.
全省新增新冠肺炎
新型冠病毒肺炎新型コロナウイルスの新たな being screened and isolated.
Not only to try to get control of the virus, but also to try to help the people.
Wuhan, the city at the heart of a public health crisis in China, is shutting its public transport network to try to prevent the spread of a virus that's already infected hundreds of people.
In Denmark, a mock-up of the Chinese national flag featuring elements of the virus appeared in a newspaper.
I'd like to just ask the Chinese for a formal apology. I have not heard one word.
Luckily, it's still finding time to get its feelings hurt and wasting time asking for apologies.
They speak to a wider bigotry towards China in the reporting of the virus in many Western media outlets. At a time when responsible journalism is required to inform the public, many of these renowned international outlets have run irresponsible stories on the outbreak featuring rumors, discrimination, and even racism. We will take you into what has become just as much an epidemic as the virus itself, that of xenophobia in the media. For much of mankind's history, infectious diseases have brought out horrible fears of contagion, and for good reason. They have been quite successful at killing people. And over the past 3 months, the real nightmare for people in China and around the world has been the disease named COVID-19.
First of all, we now have a name for the disease. And it is COVID-19, and I will spell it COVID-19.
COVID-19 stands for Coronavirus Disease 2019. And the intention with that name is to help people understand both when this disease arose, that it's a new coronavirus, and that it actually causes disease in humans, and also to differentiate it from other ones, like the ones that cause the SARS disease and other MERS disease that are caused by coronaviruses. And when we name diseases like this, we're very careful to try and avoid creating any kind of stigma and attaching it to a place or to a country.
Wuhan is the epicenter of the coronavirus
Geographical
outbreak.
names are controversial because they can be seen as stigmatizing, especially when the origin of the virus remains debatable. That was exactly the point when the WHO chose the clinical and nondescript name COVID-19. But from senior correspondents in Western media outlets to American politicians, they have other preferences. From January 21st to February 8th, Eunice Yun, CNBC Beijing bureau chief, tweeted 25 times with the hashtag Wuhan virus. U.S. House Minority Leader Kevin McCarthy has continued to use the stigmatizing language.
Trump doubled and tripled down on rejecting calling the disease COVID-19, instead calling it the Chinese virus.
U.S. President Donald Trump posted tweets using the phrase Chinese virus and drew backlash.
COVID-19 is not a Chinese virus. I mean, Donald Trump has said, and it's widely reported in conservative media, that this is a foreign virus. No, viruses do not have a nationality.
Why do you keep using this? A lot of people say it's racist.
It's wrong, Kung flu. And do you think using the term Chinese virus, that puts Asian Americans at risk, that people might target them?
No, not at all. Especially Trump calling it the Wuhan or the Chinese.
Tying coronavirus to China and Chinese people isn't just a racist dog whistle. It's a whole racist orchestra.
Why does the apparently stigmatizing name enjoy such popularity?
I thought about H1N1 outbreak in 2009. You tell me, was it called the America virus? In fact, there was even a few earlier cases, actually just before in Mexico. Was it called the Mexico virus? But this isn't the question of just the name. It's the derogatory intention behind the name.
It comes from China.
Where did it originate? It originated in Wuhan.
There's a debate in the United States. Many conservative lawmakers have been using that term, call it Chinese flu, because that means that Donald Trump will not be held responsible. I don't think that there are policies of major news organizations in the United States to use the name, but when it happens, it's wrong.
These names are obviously not liked by Chinese people, and they've taken to the internet to express their anger.
Que los hace, no lo hace con maldad, sino por ignorancia o falta de información. Pero estos pequeños detalles van acumulando y nos está afectando a una comunidad.
How can you still be in denial when Italy already locked down the whole country?
Patients in all countries are victims.
What do we find mostly in social media? We find more the younger generation of people out there expressing their voices. What I really like and what I think is fantastic, and it should be true for every country, every person should be proud of where they live and proud of the country that they live in. Look how the Chinese came together. And that's all over the national media. When you stop demonizing any country and just talk about it from a point of common sense, the majority of Chinese citizens think we have a sense of civic duty.
In fact, China has a long history of being stigmatized over disease. Echoes of that are still sometimes heard. History has shown racism does not help. It worsens a crisis like the COVID-19. From the outbreak of the COVID-19, rumors and conspiracy theories around China have spread. After the coronavirus broke out, the New York Times has repeatedly claimed that the Chinese government declined offers by international disease experts to help battle the outbreak. But a closer examination would find the claim unfounded.
中国政府始终本着公开、透明、负责任的态度，及时向国内外发布疫情信息。
各位媒体朋友，大家下午好，欢迎来到国务院联防联控机制新闻发布会，当前疫情防控正处于。
While China is seeking international cooperation in dealing with the health crisis, the country's response to the coronavirus has been described as botched, showing China's governance failure, exposing deep flaws in China's political system, or China can't help but lie about this virus.
A lot of the Western media coverage focused on the lack of information at the beginning and on social media controversies rather than the core issue itself. Could be the answer to a single question in the survey. I've done analyses over the years of global coverage of Chinese economy, and American media coverage tends to be more negative overall. I don't say that necessarily means it is incorrect, but the tonality of coverage in many of the major American newspapers, New York Times in particular, tends to be more negative than neutral.
There's a very specific and intentional and coordinated Cold War anti-China coordinated campaign. It's the Western version, the United States version of propaganda. They focus on the small thing you did wrong rather than the big thing that you did right. Even if the small thing you did wrong was weeks and weeks and weeks ago, and the huge thing you did right was yesterday, they still headline with the small thing that you did wrong. And they do that intentionally to make you look bad. Another thing that they do is what's called burying the lead. This is the same thing. Actually, there's no bad news at all. And deep down in the article, they reveal the truth, but in the headline, they start off with an accusation. The accusation is false, but they use the headline because they want more readers. And is the headline ever positive when they utilize these kind of manipulative techniques? Of course not. It's always negative.
For example, look at these two headlines from the New York Times just 2 weeks apart. The first criticizes the impact of China's lockdown strategy in Hubei province. The second headline, this time dealing with the Chinese-style lockdown in Italy, says that its approach could be a model for the rest of the world.
The Chinese government approached the WHO to ask it to stand up and say that China...
All member states were praising China for what it did. China took action massively at the epicenter, at the source of the outbreak. It's a shutdown of the Wuhan city, and that helped in preventing cases from being exported to other provinces in China and the rest of the world.
Well, look, we have never before in history put masks on 1.4 billion people and looked at the effect. So this is something we have to study and learn from as we go forward. It wasn't our recommendation as WHO based on what we knew in previous diseases and outbreaks, but China did something differently. And, China has turned around the outbreak, and I would not quickly rule out anything that it did.
Chinese reporters and global reporters who have been at the epicenter have done incredibly good work bringing facts to people. Now, what are the problems? The problems were at the beginning with transparency. There were attempts to stop information from spreading that caused difficulty.
中共中央总书记、国家主席、中央军委主席习近平作出重要指示。
I think that from the moment that the Chinese government realized the seriousness of the disease and started releasing information, and then tried to tweak the information so that the methodology was generally considered acceptable and not political.
确诊病例2829例，新增重症病例186例。
The transparency level, the number of new cases, the number of people who've died, the number of people who've recovered. I think having reliable, consistent information is crucial. I think the United States could learn a lesson from the way the Chinese government has communicated clearly with one voice. I think one of the problems in the United States as the coronavirus pandemic now spreads is that there are many different voices, and there are not the trusted voices.
In a matter of days, Dr. Li Wenliang went from treating patients to becoming one.
Chinese authorities are launching a special investigation into his death and the public concern surrounding him.
Dr. Li Wenliang died of the infection. He was hailed as a hero on social media for raising the alarm about the coronavirus in the early days of the outbreak. The Western media elaborated on the public outpouring over the death of the doctor and accused Chinese media of hiding relevant stories. But what is missing is coverage of China's efforts to address the problem.
Dr. Li is a hero.
向李文亮医生的家属表示诚挚慰问。国家监委成立调查组，就群众反映的涉及李文亮医生的有关情况，依法开展调查。
I really appreciate the way that China has exceeded the reporting in terms of transparency versus the reality of being accused that they're not being transparent. First of all, publicly announce the situation in Wuhan is very, very, very bad. Did they hide this? No. The doctors came rushing by the thousands to Wuhan to help. An incredible show of solidarity and unity. And such an emergency, and this is where we see the advantages of an authoritarian central planning type government, when they say something needs to be done, it can be done quickly.
My first impression when I landed, as I came out of the airplane into Beijing, I found this empty airport in a city of 20 million people. And it suddenly brought alive for me just a tremendous cost for the Chinese people, the Chinese economy, this terrible disease. Because when you walk into an airport like that, which is empty, it's a sudden and striking realization of what this disease can do to a country, to a capital city like Beijing.
交接文件标志着火神山医院正式交付。
No, all of it was being reported in the newspaper, clearly, all over the social media airwaves, and they even put a 24-hour live stream camera to show the hospital being built. And even still in the West, there were accusations that it wasn't being built. or that it wasn't really a hospital, or that it was just a show and propaganda.
While many Western media outlets failed to recognize China's efforts in containing the virus, many also turned a blind eye to the solidarity shown by the international community.
Just like here today, we need to support each other and stay united. Let me be clear. There is no place in our country for discrimination driven by fear or misinformation.
Despite being a global leader, Trudeau's remarks only received minimal coverage in the Canadian and global press. These stories are rarely seen in Western media reports. Even though they had been put on alert for weeks, some Western countries act as though it was none of their concern.
Made the assessment that COVID-19 can be characterized as a pandemic.
Numbers are ticking up worldwide. From politicians to passengers, none is immune from the virus.
Increase and accelerator. L'épouse Sophie avait subi un test pour la
Others outside of the continent.
China is moving quickly to lend its hand and share its experience with the world. China has shared technical documents and diagnosis and treatment plans with more than 100 countries, over 10 international and regional organizations, conducted more than 20 technical exchanges, and sent expert teams to provide support overseas. The media coverage also appears to shift, to strike a balanced tone.
What even makes these measures democratic or not? At a time of crisis, shouldn't people be focusing on which measures are the most effective?
We see the drone shots from these cities and we think, ooh, lockdown, it looks terrible, there's no traffic in the street. That's not the point of what they did. They had to do that in order to introduce the measures they were going to take that were actually going to fight the epidemic. And that is testing, 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 testing. Find the virus.
The media coverage direction on this outbreak now is moving away from China and toward the rest of the world for obvious reasons. As of today, many people are finally, ringing the alarm bell and saying, okay, enough with the happy talk.
I think the tonality has changed already. Already I am seeing stories in American media saying that there are lessons that were learned in China that can be applied to this. I think people are learning best practices from what happened in China, medically, health, the importance of quickly creating health centers, hospitals, pop-up hospitals. The coverage has changed a lot. China is now on the downward slope in new cases.
A single tree cannot block the chilly wind, goes a European saying. Similarly, a Chinese proverb has it, many hands make light work. History has taught us the cost of playing the blame game and disintegrating in a crisis, and the wisdom of sharing and helping each other out. China has been sharing as early as the disease first broke out, but the Western media readily ignored the olive branch and spent time stigmatizing and playing the blame game. The negligence costs more loss in the pandemic. How many lives would be saved, and how much less loss could we suffer from the pandemic if we stop deflecting blame and sustain a good conversation?
We can work together, cooperate together, parallel intolerance, as much as we need to go forward in the global world. The requirement is maturity and wisdom to tolerate certain differences that are never going to change.
Coronavirus is bringing out the best and the worst in people around the world. I mean, the enemy is the virus. It's a global issue, and we're all citizens of the world as well as citizens of our own countries.
The virus originated from nature. China created a window for the whole world to get ready, and get ready fast.
Like it or not, the time for solidarity is now.